says here on your bio that you are a Franciscan friar. So, Brother Solmesi, we had really hoped to see you in the friar's frock.
Thank you for that unusual introduction. I do have a habit. I wear it actually, particularly in the friary I'm now in, actually every morning. I don't typically wear it into the hospital. I was sharing with somebody this morning that I think if I were to dress like that, my patients would get a little nervous, especially if I put the hood up, Is it that bad, Doc? So I'm sorry to disappoint you, but all you had to do was ask. I would have worn it. There was no problem. But thanks for the introduction. Congratulations, Terry, on your chair. Obviously, well deserved. Thank you to the Carondelet healthcare system, to St. Joseph's Hospital here, to the Center for Practical Bioethics and Myra Christopher, and of course thanks to Sister Rosemary, who I really just met at 11 o'clock this morning, and this woman is a dynamo. I mean, it's just an absolute dynamo, and all the accolades here are richly deserved. And while Terry may think it's the hardest job in the world may be to occupy the chair, I think the second hardest one is giving the Sister Rosemary Flanagan lecture, which is what I'm about to try to do. But what she asked me to talk about was conscience in clinical care, and that's what I'd like to take some time to talk with you about this evening. It's become something of a hot-button topic in the world we occupy today, particularly in the United States. But I think the way the questions are often formulated, it becomes a clash of wills. One person says, I want to have this, and then there's somebody who says, well, I don't want to do it for you, and somebody gets this onto television, and we've got speaking sound bites, and it quickly deteriorates into a shouting match without much in the way of serious ethical reflections. In some ways, unfortunately, it's become a neuralgic point in the culture wars, and hopefully what I want to try to do with you this evening is to get a little bit beyond that. I think the first thing to say is that conscience is misunderstood. It's not, in the end, little voices inside you telling you what's right or wrong. Contrary to popular imagination, it's not little angel on one shoulder and a devil on the other from cartoons trying to help you in making judgments. And I don't think it's really, in the end, if you reflect on any kind of conscientious decision you've made in your own lives, some sort of direct intuition of right and wrong. I can tell you that's certainly not the case when we do ethics consults. If somebody says from the obstetric service, we've got these twins, one of which is doing pretty poorly in utero, the other is doing pretty well. To maximize the chances of survival of the one that's not doing well, we'd have to deliver now. That's going to perhaps endanger the life of the one that's healthy by having that one be delivered prematurely. I can tell you that if I walk into the room, and I would suggest that for any of you, if you walked into the room, the answer to a question like that is not immediately obvious. There's no intuition that tells you what the answer is to that. And so conscience is not these little voices inside us infallibly telling us what's right or what's wrong. Now, if we think a little bit more carefully about it, this is what I think conscience really is. It's in the end a fundamental commitment to have and to hold fundamental moral principles, ones that will guide you, that will be the way in which you live your life, and a commitment, secondly, to act on those principles. Right? So you make a fundamental commitment, all of us do, to in essence be moral persons, to commit ourselves to some fundamental set of values or principles and then to hold ourselves accountable for living by those principles. So in some ways, that's really what the first act of conscience is.